aneurysm is more likely to be column rather than sphere. So as our data of 47 aneurysms showed, a box diagram on the right side, median of the web volume converges to the column, the column volume. When we categorize the 5 types, we divided the symmetric and asymmetric type. Between the two groups, symmetric type median converges to the column volume median, not the spheric volume median. And then the interquartile range is wider than the asymmetric group. That means probably more the generous selection while we are doing the symmetric type of aneurysm, web embolization. Among these 5 types, symmetric group, the spheric and the column-shaped aneurysm are 75%. The rather uncommon right-sided asymmetric group, I'm going to show you a couple of cases. This asymmetric aneurysm, ACOM, boost shape, I call it, or person shape. The person is a traditional Korean socks. This is ordinary measuring method. However, we try to get another process to compare maximum volume size and then minimum size. We get the balance and then choose one appropriate web size among the web size chart. With this aneurysm had a very tight A1, so it's very difficult to get into the aneurysm, and then even the web is difficult to go into the aneurysm. Even we made a very tight curve, it comes out of the aneurysm. But we are sure the web will fit anyway because we balance the volume size anyway. So finally we positioned the web and detached it. This is dynasty. The MRI next day showed the disappearance of aneurysm and intact. Diagram shows that the very tight curve into the pole of the asymmetric aneurysm, and then introduce the web, and then push it a little. And look at the orientation of this web is very elongated from the pole to the neck. That's why when transverse compression, it elongated. But the other transverse side is not elongated. It's very specific web characteristics. Another type of lesion is a submarine-shaped aneurysm, maybe sweet potato shaped. It's necessary to get the downsizing because there are 2 poles, asymmetric or lobulated one. So we got maximum and minimum size balance. We choose one, the rather downsizing policy. This is a deployment of web. On the lateral side, the right side shows a very compact and tight fitting, but on AP view, there are still some spaces in both sides of the end. This is final angio, shows a rather well-occupied aneurysm, and then also the blocked ACOM flow, ACOM opening. That's a little intentional, but not completed. Contralateral side angio at the time increased the flow into the right side. That means the contribution from the left side is increased to the right side because of the web position. The next day, aneurysm disappeared, but there is a small neck still remains. And then after 10 days, the A1 signal is became prominent, probably due to the increased contribution from the opposite side. In diagram, the ACOM direction reversed, and the web positioned and the remaining opposite 2 pole spaces still showing, and the block ACOM opening a little, so that the next side is relatively completely packed. But final follow-up will confirm the outcome. We use a measurement made coded by Python and executed on Google Lab to expedite the measurement process and enable real-time responses like this on the right side. Otherwise, it's very difficult to calculate real-time. So this is used for suboptimal type group on the right side in the wide range of the box interquartile range upward, so that the oversizing may make a web unfit to aneurysm. We are going to reduce that suboptimal group. In conclusion, volume measurement is not a simple static procedure depending on the oversizing strategy. It's a dynamic process, especially for asymmetric shaped aneurysm, and real-time response for volume measurement is helpful. Thank you very much.